Okay, this is a sand splint. It's very manipulative. You can do whatever you need to with it. They usually put these on kiddos prior to x-rays when they come in with a obvious deformity. So I'm gonna just put it on this kiddo for a long arm, posterior long arm. So we like to pick up the kid's arm like this, very gently, 'cause when it's really broken, they're screaming and in all the pain. You can put this on very loosely. You can, and then apply an ACE wrap. Doesn't have to be perfect, just so the arm has a little more support than it does without anything on there. We put this on first because X-ray is able to shoot a picture through the same splint, and it just gives the kiddo a little bit more comfort for the arm.
Will you hold his arm up for me? I'm just gonna try to zoom in a little bit so they can see a little bit better what it is. So, thank you.
So we're going to do a posterior long arm splint on Evan here. So it's going to go all the way from right just below his armpit all the way down and to the edge of his fingers. So depending on what they're going to use it for, if he's just doing it for comfort right now, you can leave his arm kind of, you know, whatever he's most comfortable in. If he's going to go home with this and follow with ortho in a couple of weeks, you want him to usually be at an angle about like this, even if it's uncomfortable for him to move. You want him, because you don't want his arm hanging down, otherwise his fingers will swell and get really cool and uncomfortable. So we're going to show you guys how to do one of those. So first you want to make sure that you measure on the unaffected extremity so you know how long to make your splint. So we're going to go onto his good side here. So we'll open up our splint material. We're going to measure on this arm to see how long to make it. Because we want to move this one as little as possible. So Ashley's just going to come over and kind of just get a good general estimate, and then we'll cut it and we'll get things ready.
Okay, cut it here. When I gather my splint supplies, I get a splint. Obviously, you can get a couple different ones if you're not real sure. Soft roll for their skin, to protect their skin. A couple different sizes of ACE wrap, and of course some scissors that will cut through the fiberglass.
Depending on how old the child is, you may want somebody else here to help you hold their arm into position. If it's an older kid, obviously they'll be able to do it for you, unless it's a really bad break and they're not comfortable with that. So it's always good to have an extra set of hands.
This, when I cut it, the fiberglass here, if you don't cover it with the softer part of the fiberglass splint, when it dries, it's like prickly little needles. So you definitely want to make sure every time you splint that you cover it with the softer part. We'll get this wet and roll it in a towel to take out the excess water.
So getting the soft roll or getting the safety splint wet will activate it, and that's what makes it gets a little bit warm at first before it hardens up. You don't want to use hot water, otherwise it'll get too hot and be uncomfortable on the patient.
We'll leave that there, and then I'll apply the soft roll.
Soft roll first. So the thing with the soft roll, you want to make sure over joints that you pad those just a little bit extra, because that's going to be rubbing against the fiberglass splint, and you don't want to irritate or cause a pressure ulcer. Thank you for being so cooperative. You don't need a whole lot of soft padding, just one of those is perfectly fine. Just most likely they'll be falling over the ortho in a week to get their real cast anyway. So this is already pre-measured to his arm, so we'll just slide it on here. Usually I'll help her hold it into place. I think ours is just a little bit short. Usually you want it to go out to the, about at least to the mids of their fingers.
Yeah.
Just for support.
And when you are taking the ACE wrap around, you take it and you pull a little bit. Don't do it too tight or else his fingers will potentially be blue.
Does it matter which end you start your ACE wrap from?
I like to start where the break is and then go from there. I think that's just to
I
your
think it's personal
discretion.
preference. Some people will start here and go up
Mhm.
as well, so. Doesn't matter, do you? Do you have a preference?
I think distal to proximal,
Okay,
right? For
here to there.
Mhm.
And you don't have to cut a thumb hole even. You can just, like I said, it's just temporary, so you can even just, you don't have to be fancy with it.
Okay.
Some people will, because
Right.
they're nice and they like to keep their splits pretty, but it doesn't have to
Yeah.
be. If you don't have time and you're busy, it just has to wrap around. Right. So a couple of things you want to check at the end after you're done splinting, kind of hold it in place for a little bit as it gets warm and it will harden up. You want to make sure that they can still wiggle all of their fingers, that they can still feel on each one of their fingers, not just their thumb, because they have two different nerves that innervate here. So you've got these 3 fingers and these 2. So you want to make sure you can feel on every single one. Check their cap refill, make sure that it's still brisk, less than 2 seconds, 2 to 3, and make sure everything still feels nice and warm.
Does that feel okay on your arm there, bud?
Doesn't hurt any more than it did before. Okay. What about teaching, like home care teaching or discharge teaching for families? What do you guys normally tell them?
For families, I tell them that they can't get this wet, and to take like a shower or something, you can wrap it in like a trash bag or just do a sponge bath for a couple days. And it's in this nice 90-degree angle here. And if it is ever like this, you need to come back and get it resplinted right away. So that's not a good sign. It needs to stay in an angle that I put it in. And just be aware of his fingers, making sure that they're warm and that, you know, they turn pink right after you press on.
We'll make sure to tell families they can loosen the A-strap a little bit, but don't mess with don't manipulate any of the other material. At home, keep it elevated on a pillow. That will keep his fingers from swelling too as well, so he won't dangle his arm. Anything else on the rest? Can you tell them?
And we will give them a sling to take home. We want the sling to go a little past the fingers, so I would probably grab a medium sling for this splint. And they can wear the sling when they want to, but don't wear it too much because you want to keep that muscle good. But
You don't want a
just
sling
more
that's
for
going to
comfort.
stop right here though, because I've seen kids have slings that are way too small. Or one that's way out here.
Yeah.
And we'll go ahead and put a sling on so you guys can kind of see how to put the sling on after they're done.
He doesn't have to wear it at night when he's sleeping.
So the sling is like this, and I just scoop the arm in through the fingers. And then can you sit up for me, buddy? I'll help you sit up. And slide this through. Sometimes these slings are a little long on here, and so you can take this back part and you can go up like this, and then you can fold it back so it'll stay in that position, because you don't want the sling down here. You want it up where it's supposed to be.
Okay.
Okay.
Good job.
Buddy, I'm gonna pump you up before we start doing the splint. These are on our backs, okay?
So we're going to do a sugar tongue splint next, and we'll show you how that is. It's going to be, well, once again, we'll measure on his unaffected extremity. We'll do it on his right side. So we'll measure over here, and it's going to wrap around the arm a little differently than the last one. So I'm going to hold his arm, and you want to hold their arm and support their elbow. So this splint is going to be used for fractures of the radius and ulna, possibly the wrist, because you want to prevent it's going to wrap around like that, because you want to prevent his arm from being able to do this very well. It's going to stabilize that area. So we measured on the opposite side. And for this split, you definitely want somebody else to help you in here to hold their fingers straight up and to keep their arm like this, to support everything.
Don't forget to pull this up. It's a very important part. The kids will be really upset if they have little needles poking them.
Not fun. And then the soft roll.
Yeah, hold
I'm
it
gonna
on.
hold his fingers.
So we'll start at the distal end of their arm.
Try to
and
put
we'll
your
work our
thumb
way
right
up.
there.
No, just move out of the way.
Again, you just want to make sure you put a little extra soft roll on those bony prominences of the blend that you're splinting. Protect their skin and their...
use all of it. So we can use it later. We're gonna get it wet.
Doing okay, buddy?
So again, just use a little bit of cool water, get your splint wet, a little bit, wring it out in a towel. You don't need it soaking wet, otherwise it'll take forever to dry.
Something I thought about too is, as from the nurse's point of view, is pain medicine before splinting.
Yes. Oh, yeah.
So even for the techs as well, like if he hasn't had pain medicine maybe prior to splinting, that may be something that they
Sure.
want to do, just because this is obviously, if he's got a broken arm, it may be a little bit painful for this.
So for the sugar tongue, you want to wrap around and you want to go at least about to the first digit here, or the first joint of your fingers, just to make sure you support. You can even go up to the second one if you need to the tips of the fingers.
So if you happen to cut it too long, are you able to fold it over? Do you have? I mean,
Yes.
if you get to the point and it's a little bit too long, you can fold it down.
Yes, you can fold it backwards like
Okay.
this. Because
You
once
can
again,
always cut a thumb hole, sorry.
it's only going to be on there for a couple of days to maybe a week before they get it taken off.
And then with the elbow, you kind of want to, I don't know how to say this, just put
Bend
the
it in.
flaps up, yep, bend it in. And I gotta use another one.
And those, the orthotech was even saying we could leave part of that out and just wrap around here. It doesn't matter if part of it's moving out. It's just going to be temporary. Ruby makes her splints really nice.
Yeah, it's not as pretty when they're sticking out, but at the same time, I mean,
Yeah.
if you needed to, or if you forgot
It's
to fold
not
that in, then
huge
it's gonna be
deal.
okay. So
And it will be in a sling too.
it will, yeah.
You want to also keep it in that same 90-degree angle as much as you can.
Feel it getting warm? Can you wiggle all your fingers?
After you finish a splint and the patient is finished,
You
you want to make sure that you need one of the doctors or the nurse practitioners or the PAs, you need them to check off on the splint to make sure that they think it looks all right as well. So when you chart that, you need to chart what side that you did it on, what kind of splint that you did, which provider checked it off, and that you checked to make sure that they still had circulation, motion, sensation in their fingers when it was finished, and that the family was educated on how to take care of it at home. So that's all things that you'll chart in Epic. Okay.
All right, good job, bud.
Okay, so we got an order for an older gutter. That splint is not used often, but sometimes. And if you're unsure of what it is, you can always go to your provider and ask them what exactly they want. And they will be more than happy to explain to you what it is, or help you look it up, or whatever they need to do. When I go to do a splint, the first thing I do is go and look at the kid and see how big they are, because one 4-year-old could be bigger than the other, vice versa. So then I will go and gather my supplies for this. I think I'll need a 3x12 splint and just some littler ace wrap, a littler soft roll. And then for this kiddo, he could probably be in a child sling. So again, we'll do the same thing as previously. We'll measure and cut if we need to, and apply soft roll. Okay, so first thing I'll do is
We'll measure on your other arm.
take this out.
This splint is used for fractures of the fingers or of your hand, or sometimes a very distal radius ulnar fracture around the wrist here. So yeah, well, you'll keep it straight, and it only really covers about this much. So we'll measure on the good side. It doesn't hurt, it's not broken. And it only wraps around the last 2 fingers of your hand. It doesn't wrap around your whole hand. And it's literally like a gutter on your house. It'll just kind of wrap around that side of the arm.
You want to be careful too if you are in a reduction. The doctors don't take this out until they have reduced the arm, because this will harden. That was my first mistake, my very first reduction.
What did you say?
This will harden really fast.
If you let it sit out too long without using it, it gets hard.
Okay, so I'm just
Right.
going to wrap this around your arm,
Use your
okay?
arms, just those last 2 fingers, and put some soft roll kind of, around the fingers. And this is the one where you want them to bend them a little bit, right? Usually their last 2, you'll bend them in just a little bit. You don't have to worry about joints as much on this one. It's really just kind of the wrist bone. It's just gonna get her splint wet.
that feel funny?
You guys will leave it alone. And she'll see she'll just wrap it underneath that side of the arm.
Let's see. Just go back in.
You're doing a good job.
Doing okay, bud?
Yes.
Got questions?
Yeah.
No?
So they don't always need a sling. You can ask the provider, whoever, if they want them to have a sling to go home with. We'll just put one on your hand just to show you.
Where's your other finger?
Make sure you can see the tips of his fingers as well, so you can check to make sure they're not turning blue or purple or getting cold to the touch. You can move all your fingers. Can you wiggle them for me? Yeah. Can you feel me touching them?
Will you hold it up, Ashley, so I can see? There we go. Thank you. You can kind of see what it looks like, and then hold it like this. I can kind of see the bend in his fingers a little bit. Thank you.
It looks a little bulky because he's little. It will look less bulky on a larger child, of course, but once again, it's just temporary. And then we'll put this little sling on.
Get some dinosaurs. You like them?
I like dinosaurs.
You like them? That's cool. Sit up just a little bit. Thank you.
Dinosaurs are my favorite animal.
Who's your favorite dinosaur?
Oh, this one's kind of big too.
Tyrannosaurus Rex.
The T-Rex?
Mm-hmm.
This one is a little different than the large ones.
Here we go. All right, we're all finished.
There you go.
All right, so next we're going to do a posterior long leg on this kiddo here. These are used for femur fractures, so you want to make sure that the splint goes all the way up to basically to just below, like they call it technically the gluteal cleft, but you want to make sure it goes right here, if not a little bit farther. So kids with femur fractures, they're going to have surgery within the next 24 hours, if not immediately. So it's really just for stability. It doesn't have to be perfect like any of the others, but you want to make sure that, so we're going to measure on the opposite side. And for babies that are in diapers, it's okay, just, they'll work around it. You want to make sure that it really goes up as high as you can without moving that leg as little as possible. Right about here, probably. Always double check with the provider on this one, how high they want it to go up. Occasionally, depending on where the break is at, if it's really high, they may want the splint to even go up past, like up to the top.
Yeah, and obviously you can't wrap that with an ACE wrap, so
Right.
that top flap would just be out a little bit. But if the break is a really high femur fracture, then that's when you would want to go up pretty high. So.
And you wouldn't really soft roll that very well. I would just put some underneath it so
Mhm.
the fiberglass doesn't rub against it, and just,
Yeah.
it doesn't have to be perfect, just so it gives it some padding. You want to make sure that their foot is flexed like how it is, like they're doing. You don't want their
You bend
foot
your
to be
knee
like
just a
that
little.
too much.
Relax.
Otherwise, once again, blood's going to drain to the end of their foot, and it's going to have difficulty coming back up. So.
Just gonna move your shorts up just a little.
When you're at this part, whoever is helping you hold, because you'll definitely want another set of hands, is going to hold on either side, being very careful where that break is to make sure that they don't manipulate that leg and make it worse than it already is. We don't want a closed fracture going to an open fracture. So you soft roll as high as you can up to their groin area. Obviously, it's going to be, you can't really soft roll their pelvis, but.
Doing okay, bud?
And then it's going to go from underneath all the way to the edge to the end of their foot.
Bend in the knee.
Mm-hmm.
Very nice.
And that's just for comfort.
Try to roll you over just a little bit.
You'll have to go that way just a little. Sometimes you'll have to have them roll just a little while someone holds that femur. And then we'll wrap and kind of just a little bit, and then it'll be finished. Sometimes you can kind of, and you'll prop that leg up on a pillow too, probably to help the blood drain back down. I would. Or a blanket, because we don't have pillows out here, so a couple of blankets. And the same thing with the arms, you'll check his toes, make sure he can feel everything on each toe, make sure his skin is nice and pink and warm. With femur fractures, after they're done, and once you have the doctor come and check your splint to make sure it's good, if they're complaining of a lot of pain, sometimes the pain medication doesn't always work as well for those, make sure you let the nurse know if they're still having problems and still complaining.
Feel it get warm?
And on these, you wrap up with the H-wrap as high as you can to their groin, and then sometimes some of the older kids, his age, he may end up having to have like a diaper temporarily, just for where the splint placement is. But.
Wiggle all your toes.
All right, and then we'll just prop him up in a couple of blankets, and he'll be done.
All right, good job.
All right, so our last splint that we're gonna do is the Robert Jones splint. It's going to be for it's just a short lower leg, and it's gonna do a posterior lower leg with a stirrup on around it. And the reason for that is you want to prevent this ankle from being able to turn like this back and forth. You want to keep it straight. So for ankle fracture, possibly a distal tib fib, like a lower fracture, not one closer up. So we'll show you how to do that. Most likely you'll need two splint packages here, since you want to have one splint here and one splint that wraps around. You won't have enough from just one, unless it's maybe a little kid, you might, a shorter kid. So we'll measure on this side. We hope that your patients don't have stinky feet. Perfect. Yeah, that'd be right. So this one you want to go just below the back of the knee, right here. This one, I think for him, for example, it might be a tad short. If you had to, you could get another splint. For a really tall kid, you could get another splint and just do like a layered around it if you needed to. If that makes sense. So if you needed to, you could get one here, grab another splint, and finish it the rest of the way if you was somebody a lot taller. Yeah, posterior long leg, then the stirrup. So usually we'll do the posterior long leg first, and we'll do that underneath after the soft roll, and then we'll do the stirrup part second over that, and then we wrap it all up. So once again, you want somebody here to kind of support that leg, to make sure it's not just dangling where the break is. You want to make sure their foot is flexed enough and not pointing downward. You want to make sure on these that you wrap the ankle really well, the same with the posterior long legs, because that's the joint where you can get a pressure ulcer on if you don't have enough padding. Bend your foot just a little. Yeah. So we probably have a smidge too much padding around here, but that's okay. I'd rather have too much than too little. So posterior long leg first. Do you do the wrapping first?
Sometimes I'll do like curl it.
Do you wrap with ace wrap and then do the stirrup part? Or do you
I
just
think you can. I think you can wrap individually.
Okay.
It may be easier to wrap individually, you know what I mean, to wrap individually, because that way that one stays in place while you're trying to get the other one done.
We don't do these very often. Just make sure that your foot's flexed.
I don't think either way is wrong necessarily, but just
I
for
think they are
stabilization, you know what I mean, it may be easier to do it like that and then do your other one over it.
If your ace wrap doesn't go all the way up, it's not the end of the world, because we're going to wrap it again.
Yeah,
And
that's
now
what
we're going to do the stirrup. It's going to go on either side of the ankle. And just support that. Once again, ours is a little bit short. We would probably use a second splint to make it just a little bit longer. But
And this will be bulkier just because we've got two splints around it, but that's okay. So. again, this is just more of a temporary, they'll go and get a cast on in the office here in a few days or so.
You'll also be giving this patient crutches to go home with, so you'll be doing crutch teaching with them as well. Make sure they can wiggle their toes, don't get it wet, etc. You can still be touching each of the little toes. You can prop it up on a pillow, make sure they want to prop it up on a pillow when they go home. Just keep the lever draining. And since this has got two, you might want to, you could shape it a little bit more and kind of press it and make sure that their foot is exactly how you want it positioned, because you don't want it to dry like that. So.
You always want to make sure you can see all digits of the toes or fingers. And with the foot, you don't want it to be like this. You want to make sure to educate the family member that you don't want it like that, you want it like this.